Doctors try to get a handle on the spread of COVID. They're also trying to help those still suffering from the disease. And new research suggests that CBDs derived from cannabis could help in the treatment of dangerous lung inflammation related to COVID. Joining us now is the author of this new research, Dr. Mahesh Mahan with the Texas Biomedical Research Institute. Doctor, thank you for spending some time with us.
Yeah, thank you for having me on your show.
Tell me what you found in your study. How about CBD? What does it do? What are the properties that help maybe with lung inflammation?
So this is not a study. It's actually a letter to the editor that we submitted in July of last year. So we have been doing preclinical studies using the non-human primate model of HIV infection for the last 10 to 12 years, looking at the impact of cannabinoids, in particular THC, which is the most psychoactive cannabinoid in the marijuana plant, on HIV-induced chronic inflammation. Interestingly, we found that long-term THC administration, administered at low doses, exerted significant anti-inflammatory and anti-fibrotic effects. So around mid-February of last year, it became clear that severe COVID disease was driven by a massive cytokine storm, resulting in systemic inflammation, blood clots forming in the blood vessels, leading to stroke, and also lung fibrosis in patients after they recover from the active disease.
Well,
based on our
previous
experience, working with the HIV model, we felt that cannabinoids may be beneficial in suppressing the cytokine storm and also reducing COVID disease severity.
Well, we know that CBD has anti-inflammatory properties to it, but you mentioned earlier THC. That's the psychotropic component of cannabis. Is that part of this, or is this not THC?
These are two different cannabinoids present in the marijuana plant. We have done some preclinical studies with THC, but then in this article, we highlighted the importance of CBD. Basically, we highlighted the anti-inflammatory, anti-fibrotic, and more importantly, anxiolytic properties of CBD. And again, we suggested that CBD could be administered either alone or in combination with THC, or both drugs, administered along with antivirals like remdesivir.
Doctor, do we know what it is about CBD? I mean, now millions of Americans are taking CBD, and again, CBD is an extract that doesn't get you high. It's just an oil from hemp or marijuana, but a lot of people really swear by the anti-inflammatory properties of it. Do we know why it works in that way?
No, unlike THC, THC binds to two separate receptors in the body, called cannabinoid receptor 1 and 2, and it exerts its anti-inflammatory effects through cannabinoid receptor 2. However, for CBD, we do not know the exact mechanisms, but several mechanisms have been proposed. There are other receptors that CBD can activate in the cell, and in that way it can exert its anti-inflammatory and even anti-fibrotic effects.
One more thing, if you take CBD, people also talk about the effects of like lowering anxiety and stress, that it has that effect sometimes. Is that a byproduct that some of the patients who've used this in connection with coronavirus have experienced?
No, so CBD in small randomized clinical trials, it's been shown to reduce anxiety in healthy volunteers, in people with social anxiety, in people with risk of developing psychosis, in Parkinson's disease patients, and even in heroin use disorders. It does affect the serotonin system in the body. So yes, CBD does have, they have reported anxiolytic effects. Again, larger clinical trials are needed to confirm these effects.
Dr. Mahan, thank you so much for your time, and continued luck on your research. It's very interesting.
Thank you.
Thank you.